A lot of times when teachers or parents see their child acting out a lot or being very hyper, acting with strange behavior, they'll think that the child has ADHD. They'll just kind of jump to that diagnosis or have these fears about it, when in actuality it could be more along the lines of depression. People don't think about depression in terms of kids looking like anything other than sadness, kind of what we would stereotypically think of depression. And a lot of people don't realize that kids have depression, that young kids can actually have depression. And of course, teenagers, all ages of childhood can experience depression. And it can be very misdiagnosed because while some of the symptoms look similar to the way it looks in adults, some of them are different. Children can often evidence irritability, acting out behaviors, non-compliance. They can become hyper with their feelings and emotions in a way that often is misdiagnosed as ADHD or looks like hyperactivity. They also can have a lot of the similar symptoms, such as crying a lot, or eating too much, eating too little, sleeping too much, sleeping too little. Those are all consistent with depression. But kids get depressed as well at young ages for various reasons. Divorce, moving, big losses or changes in their lives. Depression is also genetic. Depression can come from sometimes circumstances in the home. I have seen in certain clients with, particularly with young children, that if they have a depressed parent in the home, they can often have behaviors that are consistent with depression themselves. They definitely have behaviors that are in response to a parent's depression. It's because, and it's, I want to be careful that people don't hear that as blaming a parent, because that's not the case at all. When you think about it, it's because of the bonding that takes place between a parent and a child. The child's world is reliant upon their caregiver, their parent. And so when a parent is depressed, a child does not understand why the parent's behavior, mood, activity has changed, and so their behavior acts out in response to that. And so the best thing to do in a scenario in that situation where a child is showing any kind of behavior is to have help, to get them to some help, to take them to a therapist, a counselor that is licensed and trained in working with children with depression. Or specifically with behaviors, acting out, non-compliant, maybe aggression in school where there was none before, talking back to teachers where there was none before, hyperactivity, inability to concentrate, a sudden change in personality or behavior in this child where this was not happening before, something that is a marked difference in their behavior. And you would take them to a therapist, to a counselor who uses play therapy, who uses art therapy, who uses things that are the language of children, that children will best communicate, will be able to express their feelings. Part of treatment for children with depression is having a parent be involved. That is one of the most effective ways, because a parent is with a child all the time. The therapist is going to be with them maybe an hour a week. A parent's going to be with them all the time. And so a really good treatment program for a child experiencing any kind of depression is going to be to involve a parent, to equip a parent and to equip the child or teenager, adolescent with skills and the ability to rely on each other and to be able to be healing factors for each other. People will often ask about medication in children when treating depression, and the truth about medication is that it can be a very helpful tool in treating depression. It is not always necessary, but it sometimes is. And it can be very scary for people to think about giving a child medication. The best thing for a parent to do if their child is in any kind of treatment for a mental health diagnosis, including depression, is to ask a doctor, to take them to a doctor who is trained and able to diagnose depression or ADHD, whatever the case may be. Take them to someone who has the experience with that disorder, who's going to appropriately be able to medicate and monitor. So a child psychiatrist, someone who's going to be able to know exactly the right diagnosis for that child and monitor it so that if your child is using medication as a form of treatment to go along with counseling, it may only be short term. They only use it as long as they need it, and then they're taken off of it.